Ever had that moment right before sex where your erection starts to fade, even though your mind is absolutely in it? You're attracted, you want it, but the harder you try, the more your body tightens up, and the less responsive everything feels. The thoughts start spiraling, your heart rate ticks up, and the window closes. It's frustrating, it's common, and it's not a character flaw. There's a quiet 1-minute reset you can use in the moment that often brings firmness back by working with your nervous system and your pelvic floor. I'm Dr. Fiona Grey, men's health expert. Quick heads up. I've linked my 2 favorite natural supplements for erections and stamina in the comments. They're genuine game changers, and I'll explain why at the end. Now, let's begin. First, an honest reality check. If erections fail most of the time, or if you've lost morning erections for months, treat that as a health signal, not a personal failing. Prospective cohort research shows erectile dysfunction can precede cardiovascular disease by a few years, and major urology and cardiology guidelines recommend proper evaluation for persistent ED because it often travels with high blood pressure, abnormal lipids, insulin resistance, sleep apnea, depression, and low testosterone. The point isn't to scare you, it's to make sure you get credit for catching an early signal. A check-in with your clinician can identify reversible drivers and set you up with the right plan. Now, let's talk about the quick reset and why it works. There are 2 levers you can pull in under a minute. Lever 1 is your autonomic nervous system. Under pressure, the sympathetic fight-or-flight branch takes over. Breathing gets shallow, muscles tighten, peripheral blood vessels constrict, and arousal collapses. Clinical studies show that slow, controlled breathing with a longer exhale nudges the body toward parasympathetic, rest and digest dominance, often measured by improvements in heart rate variability and vagal tone. That state change supports the vasodilation and smooth muscle relaxation erections rely on. Nasal breathing adds a second advantage. Physiology research has shown the paranasal sinuses release nitric-oxide, and humming during a nasal exhale can markedly increase nasal no for a short window. Useful because nitric oxide is the body's own signal for blood vessel relaxation and flow. Lever 2 is your pelvic floor. The bulbospongiosus and ischiocavernosus muscles are part of your erectile support team. When they gently contract, they push blood toward the glands, compress venous outflow at the base, and help maintain the veno-occlusive seal under the tunica albuginea. Anatomical and functional studies confirm this pump and trap contribution, and a randomized controlled trial in men with erectile dysfunction showed that targeted pelvic floor training produced greater improvements in erectile function than lifestyle advice alone. Put simply, a precise, gentle contraction can give inflow a nudge and help keep it there at the exact moment you need it. Here's the 1-minute breathe and squeeze routine you can use discreetly during foreplay or anytime you feel firmness slipping. Set your posture first. Unclench your jaw, drop your shoulders, soften your abdomen, and keep everything quiet and subtle. No one needs to notice you're doing it. Inhale through your nose for about 4 seconds, low into the belly so the rib cage expands gently. Hold very softly for 2. No straining and definitely no bearing down. Then exhale for 6 to 8 seconds, through the nose or pursed lips, letting your whole body drop a notch. If you're comfortable, add a very gentle hum on the exhale to ride that transient nasal nitric oxide bump. As you exhale, add a gentle pelvic floor contraction, the same subtle lift you'd use to stop urine midstream. Keep it precise and quiet. No squeezing glutes, no clenching abs, no pulling the thighs together, and no breath holding. At the end of the exhale, relax completely for 2 to 3 seconds. Repeat the cycle 3 to 5 times. Most men feel warmth, fullness, and better rigidity by the last cycle, as stress chemistry eases, vascular tone normalizes, and the pelvic pump assists inflow and trapping. If you want a 20-second booster, add 10 easy bodyweight squats or brisk step-ups before or after those cycles. Exercise physiology studies show that even brief muscular activity increases endothelial shear stress, which is one of the cues your arteries use to release more nitric oxide and improve moment-to-moment dilation. You're not trying to get winded, just giving the system a friendly nudge toward flow. What should you expect? This works best for mild or situational ED, nerves, fatigue, a long day, or a lapse in focus. It won't override significant vascular disease, nerve injury, advanced diabetes, or severe androgen deficiency by itself. But even in those cases, it's a useful skill to stack with medical care. If your issue is persistent, get evaluated. Guidelines recommend checking blood pressure, lipids, fasting glucose or A1C, and screening for sleep apnea when appropriate, along with a morning total testosterone if symptoms suggest an androgen issue. Addressing those drivers, plus a smart fitness plan, is the highest leverage route to dependable erections. A quick word on what not to do during the reset. Don't bear down or push against a closed throat. That Valsalva maneuver spikes pressure and can paradoxically reduce inflow. Don't oversqueeze the pelvic floor so hard that you recruit glutes, abs, or adductors. That creates countertension and can irritate the area if you already have pelvic floor tightness. Gentle, precise, and rhythmic is the rule. If you have chronic pelvic pain, prostatitis, recent surgery, or significant curvature, Peyronie's disease, get individualized guidance before you train. Because you asked for substance, here's the mechanistic why in plain English. Erections require the smooth muscle within the corpora cavernosa to relax so that sinusoidal spaces can fill with oxygenated blood. When those spaces expand, the tunica albuginea stretches and compresses the emissary veins. This is the veno-occlusive mechanism that keeps blood in long enough for firmness. Sympathetic stress chemistry blocks that relaxation and narrows inflow. Parasympathetic dominance does the opposite. Slow breathing reduces sympathetic drive and increases vagal tone, which favors nitric oxide signaling. Nasal breathing and occasional humming can augment local no availability. And a well-timed pelvic floor contraction helps push blood forward and hold it, especially when combined with the longer exhale that relaxes the rest of the system. That's not theory. These elements have each been demonstrated in the research literature, from controlled breathing studies that raise heart rate variability and lower sympathetic markers, to basic and clinical research on nitric oxide physiology, to randomized trials of pelvic floor training, improving erectile function. If you like structure, try this practice plan so the reset is second nature when you need it. Once a day for the next week, do 3 relaxed cycles of the breathe and squeeze while you're fully clothed, just to groove the pattern. On 2 or 3 days, add 5 to 8 gentle pelvic floor lifts, holding each for 5 seconds, with a full 5-second release. Think quality over quantity. On most days, get at least 30 minutes of walking, and add 2 strength sessions focused on push, pull, hinge, and squat patterns, because exercise training improves endothelial function and erectile quality in clinical studies. If you snore, wake unrefreshed, or doze off during the day, talk to your clinician about screening for sleep apnea. Treating it can improve testosterone, energy, and sexual function. And if mood is dragging, anxiety is high, or alcohol has crept up, address those directly. They matter more than most men realize. A few common questions come up. Can I make this too strong? Yes, more is not better. If you feel pain, numbness, or increased pelvic tension, you're overdoing the squeeze. Ease back to a barely there lift. How fast will it work? Often within the first minute, because the technique targets both the nervous system and the local pump. Will this build permanent size? No. The durable benefit is better erectile quality and reliability. Permanent length increases require months of dedicated traction therapy under medical guidance and are modest when they occur. Can I stack this with medications? Yes. If your clinician prescribed a PDE5 inhibitor, the technique pairs well. Always respect dosing and safety guidance. Here's your quick recap to internalize. When firmness dips, don't chase it with worry. Slow your breathing, lengthen the exhale, and keep it nasal if you can. During each long exhale, add a gentle pelvic floor lift to press the pump. Do 3 to 5 cycles. Optional. 10 easy squats to nudge nitric oxide with a brief bout of movement. If ED is frequent or severe, book a check-in and work the big levers: blood pressure, glucose, lipids, weight, sleep, stress, fitness, and testosterone in the right context. Be kind to yourself. This is physiology, not failure, and you can absolutely retrain it. As promised, here's how 2 natural options can complement the technique while you build the big habits. Organic watermelon extract, L-citrulline, is a precursor that the body converts to L-arginine, feeding the nitric oxide pathway. Small controlled studies have reported improvements in erection hardness for some men, especially when taken 30-60 minutes before intimacy or practice. An advanced performance blend that combines Icarian, Tonkat Ali, fenugreek, nettle root, and citrulline is formulated to support blood flow, stamina, testosterone, and prostate comfort as part of a comprehensive plan. Neither will lengthen the penis, neither replaces sleep, training, stress control, and medical care, and individual responses vary. But used responsibly, they can assist circulation and sexual energy while you work the fundamentals. Thank you for watching. See you in the next one.